Good afternoon. My name is Eddie Jimenez. I'm going to talk about alirocumab and cardiovascular outcomes after acute coronary syndrome. Background and definitions. Patients who have had acute coronary syndrome are at high risk for recurrent ischemic cardiovascular events. They sought to determine whether alirocumab, a human monoclonal antibody to properly convertase subtly caxin type 9 will improve cardiovascular outcomes after an acute coronary syndrome in patients receiving high-intensity statin therapy. Adalimumab is a drug indicated in the treatment of hyperlipidemia. It is a monoclonal antibody that works by binding to the PCSK9 protein. It belongs to a new group of lipid-lowering drugs called proprotein convertase substituting caxin type 9 inhibitors.
Alirocumab is a new medication for the treatment of dyslipidemia. Alirocumab is a human monoclonal antibody to PCSK9. It is used to treat high cholesterol which is not controlled by diet and statin therapy. Those with statin intolerance will also benefit from this drug. Please subscribe to this channel for future updates. Click on the subscribe button. Press the bell icon after that for all updates. Several patients treated with currently available oral lipid-lowering agents do not reach target low-density lipoprotein cholesterol levels recommended by clinical guidelines. The cardiovascular risk of these patients remain significantly high. Earlier, these patients had only one option, LDL apheresis. Now there is an additional option, PCSK9 inhibitors. Currently available PCSK9 inhibitors must be given parenterally. Function of PCSK9 is to bind to LDL receptors on hepatocytes and promote their degradation in endosomes and lysosomes. The reduction of LDL receptors lead to increase in levels of LDL cholesterol. Inhibition of PCSK9 by drugs like alirocumab can produce marked reduction of LDL cholesterol levels. Indication for alirocumab: those with high cardiovascular risk from atherosclerotic disease or heterozygous familial hypercholesterolemia and unable to reach target LDL-C level.
Applications in medicine. They conduct a multicenter randomized double-blind placebo-controlled trial involving 18,924 patients who have had an acute coronary syndrome. 1 to 12 months earlier had a low-density lipoprotein cholesterol level of at least 70 mg per deciliter, a non-high-density lipoprotein cholesterol level at least 100 mg per deciliter, or an apolipoprotein B level of at least 80 milligrams per deciliter, and were receiving statin therapy at a high intensity dose or at the maximum tolerated dose. Issue apply in Ecuador. In Ecuador, there has been many trials that approve the use of alirocumab according to SAVANET EC. Among patients with a prior acute coronary syndrome receiving high-intensity statin therapy, the risk of recurrent ischemic cardiovascular event is lower for those treated with alirocumab. The absolute benefit of alirocumab or the primary composite endpoint was greater among those with a baseline LDL cholesterol level of 100 milligrams or more per deciliter than among those with a lower baseline level. This is the video. Next, we have the pros and cons. Pros. Thanks to the practical use of alirugumab, it helped to reduce the LDL cholesterol.
If you have acute coronary syndrome, you have one or more conditions caused by a blockage of blood flow to your heart muscle. This is a medical emergency because you may be having a heart attack, a condition in which your heart muscle begins to die. Your heart is a muscular organ that pumps blood containing the oxygen and nutrients your body needs. The main pumping chamber of your heart is the left ventricle. When your left ventricle contracts, it sends oxygen-rich blood to your body through a large artery called the aorta. Connected to your aorta are small arteries called coronary arteries. Blood flows from your aorta through the coronary arteries to supply your heart muscle with oxygen and nutrients. If you have acute coronary syndrome, blood flow through your coronary arteries is severely reduced or completely blocked. One possible cause of reduced blood flow is atherosclerosis. In this condition, a buildup of a fatty substance called plaque can narrow your coronary arteries. If this plaque ruptures, a blood clot can form and block the artery. A blood clot is the most common cause of coronary artery blockage. Other less common causes of reduced blood flow include coronary artery spasm or dissection. In a coronary artery spasm, triggers such as drugs, smoking, cold weather, and extreme stress or emotions can cause a temporary and sudden tightening of a coronary artery. During a coronary artery dissection, the inside wall of one of your coronary arteries separates, which can block blood flow. Regardless of the cause, a blockage in either coronary artery prevents the oxygen and nutrients in your blood.
Next, we have the pros and cons. Pros. Thanks to the practical use of alirugumab, it helped to reduce the LDL cholesterol level. The cons are that even the alirugumab is good, other statins are way better to reduce the risk of coronary disease.
Had been a concern, at least among some people, that very low LDL levels as achieved by PCSK9 inhibitors, especially with multi-year therapy, might lead to various problems such as neurocognitive problems, new onset diabetes, elevations in muscle damage, elevations in liver enzymes, that sort of thing. And in fact, we didn't see any of that. The only excess was a slight excess in injection site reaction. So the drug was very well tolerated, very safe. The discontinuation rate was no higher than placebo. So overall, we've shown a very safe drug, including with multi-year therapy. There were patients receiving therapy for over 3 years. In fact, over 40% of the population was treated for over 3 years. So intermediate to long-term therapy and no safety signals identified. LDL was of course reduced, that's already known with this class of agents, but I will point out this was the first treat-to-target trial in the field of cholesterol lowering. The goal was to get patients within a range of LDL of 25 to 50, so there was some down titration of the alirugumab dose or discontinuation on purpose if the LDL levels got quote-unquote too low, say below 15 milligrams.